All good things, they say. New South Wales almost made it to 28 days without a new mystery COVID case. But just 2 days shy of that milestone, a hotel quarantine worker in Sydney has tested positive. The Premier says Monday's sweeping changes to restrictions are still scheduled to go ahead for now.
Tens of thousands of people have now filtered through Sydney quarantine hotels. But a housekeeping staff member from Minto in the city's southwest has now become infected.
She did not have contact with infected overseas quarantine patients directly and had minimal contact. So at the moment, there isn't a smoking gun in terms of how we would say the transmission event happened.
The fact that this has occurred is unfortunate, but it's not unsurprising.
The housekeeper worked at the Novotel at Darling Harbour, which is being used for quarantine, as well as its sister hotel next door, which is operating normally. She tested positive last night, but was experiencing fatigue on Saturday. The woman travelled on several trams and trains between Central, Minto and Lidcombe, while potentially infectious. All other passengers who used those services around the same time have been told to get tested and self-isolate.
Obviously, the Minto to Central route, on average, from some of those journeys was about an hour. Unfortunately, we don't know the particular carriage. She did wear a mask.
Scientists are now rushing to map the genome of the virus to work out its source. The Premier has warned the new case could affect plans to ease restrictions.
I don't want to underestimate this. This is a test for us because we have further restrictions easing on Monday. We've just been made aware of what is potentially a very serious and unfolding situation.
Western Australia says it will monitor the case before it decides whether it will push back next week's border reopening. But there's optimism New South Wales will contain the infection.
As always, I have great confidence in the New South Wales Government's testing and tracing capabilities. They're gold standard not just in this country but anywhere around the world.
Questions have been raised over why the woman was allowed to work at 2 hotels if one was a quarantine facility.
We appreciate that is the normal course of activity for many people, and whether it's being in another hotel or being anywhere in the community, the risk is the same.
A stark reminder the virus is still out there. Kathleen Ferguson, ABC News, Sydney.
And Kathleen Ferguson is outside the Novotel at Darling Harbour for us this evening. Kathleen, there's meant to be regular testing of all hotel quarantine workers. Is that happening?
Well, Juanita, it seems like it's not happening at the moment, at least not for all Sydney quarantine hotels. We know that National Cabinet decided from November 18 that all states and territories would introduce mandatory weekly testing for all staff working in all quarantine facilities across Australia. The Deputy Chief Health Officer said that we needed extra surveillance to mitigate the risk of the virus being reintroduced into Australia, especially after what we saw in South Australia with that COVID-19 outbreak being linked to a hotel quarantine case. Now, New South Wales Health has told the ABC this evening that it is still working with New South Wales Police to roll out that weekly mandatory testing at its police-run facilities here in Sydney. So it does raise questions about why it's taken this long to roll that out, and if it had been rolled out, would this case we've just seen been picked up sooner?
Kathleen Ferguson reporting there.